Right now, there are peptides that can literally transform your body and your life. One that's more powerful than semaglutide for effortless weight loss. Another that targets stubborn visceral body fat, the most dangerous fat in your body. And one so effective at burning fat and building muscle, it's called anti-obesity drug. Even better, there's a peptide known as the Wolverine peptide for its insane healing abilities. In this video, I'm breaking down the top 7 peptides you need to know about, what they do, how they work, and why many of them are incredibly safe and why they're changing the game in health, longevity, and performance. Hi, I'm Dr. Will Haas. I'm a board-certified physician and integrated medicine specialist. And before we get into the specific peptides, we need to talk about why this topic is confusing in the first place. You've probably heard about peptides from biohackers on social media or the latest celebrity anti-aging trend that everyone seems to be jumping on. So when you first hear about them, you probably think that they're either too good to be true or just another wellness fad that's going to disappear in a year or two. In fact, if you start doing research online, it gets even worse because peptides are being marketed for virtually every health concern you can possibly imagine. We're talking about weight loss, muscle building, injury healing, immune support, anti-aging, cognitive enhancement, better sleep, hair growth, skin rejuvenation, and the list just keeps going. When you see something being advertised as a solution for everything under the sun, starts sounding like the old-fashioned snake oil that claims to cure every disease known to man. And we all know that if something claims to fix everything, it usually fixes nothing. So if you want to truly understand peptides and separate the proven science from the marketing hype, you need to understand these 7 specific peptides that I'm about to walk through. All right, let's start with the first peptide on our list, and this one has earned itself a pretty interesting nickname. This peptide is called BPC-157, and it's nicknamed the Wolverine peptide because of its remarkable healing abilities. BPC stands for body protection compound, and the 157 just refers to a specific sequence of amino acids in the chain. This is a 15 amino acid peptide that was originally derived from a protective protein found in human gastric juice. Croatian researchers discovered it back in the 1990s when they were studying how the stomach protects and heals itself from damage. It activates something called VEGF receptor 2 pathway. And what this does is promote the growth of new blood vessels in a process called angiogenesis. When you increase blood flow to damaged tissue, you're bringing in more oxygen, more nutrients, and more of the building blocks that your body needs to repair itself, which is why this peptide has become so popular for healing injuries. There are 36 animal studies conducted between 1993 and 2024 that show healing benefits for tendons, ligaments, muscles, and even bones in various animal models. We're talking about rats, mice, and other laboratory animals that showed significantly faster recovery from injuries when they were given BPC-157 compared to animals that didn't receive it. But there's been only one human study published on BPC-157, and it was a relatively small study where 7 out of 12 people with chronic knee pain experienced relief that lasted for 6 months or longer after receiving a single injection on the peptide. That's promising, but it's also a really small study with only 12 participants, which means we're still in the early stages of understanding how this works on a human scale. BPC-157 is not yet FDA-approved for human use, and it is currently classified as a research chemical, which means the human safety data is still developing despite decades of compelling animal research. People are using BPC-157 through subcutaneous injections, which means injecting it under the skin, or intramuscular injections directly into the muscle, and some people are even taking the oral version of it. Because it's not FDA approved yet, there's no standardization dosing protocol yet established, and quality can vary significantly between different suppliers and manufacturers. The animal research is generally impressive, and the mechanism action makes scientific sense, but anyone considering this peptide should understand they're working with a compound that is still being studied in humans. This is why working with a knowledgeable physician who understands peptide therapy becomes particularly important when considering BPC-157. Now, let's move on from one of the most experimental peptides on the list to one of the more well-researched and safest available. Thymosin alpha-1, which people often call TA1, is a 28 amino acid peptide that your body naturally produces in the thymus gland. This one actually has FDA approval and is available in over 35 countries worldwide. We have decades of clinical use in treating hepatitis B and hepatitis C, and it has a really good safety profile based upon what real-world use in actual patients. It's been used successfully in immunocompromised patients dealing with serious conditions like HIV and sepsis, and there's emerging research suggesting it may help with autoimmune conditions like rheumatoid arthritis, lupus, and multiple sclerosis. The way thymosin alpha-1 works is by modulating and supporting your immune system, which means it helps balance your immune response rather than just boosting it indiscriminately. Peptide is generally very well tolerated with minimal side effects, which makes sense given that it's based on something your body actually produces naturally. This is generally one of the most well-researched and safest peptides available, especially compared to some of the more experimental options we're going to talk about. Next up, we're looking at a peptide that's unique because it works both on your skin and inside your body, and it's become famous for its anti-aging properties. It's called GHK-Cu. It's a naturally occurring copper-binding peptide that's found in your blood plasma, your saliva, and even your urine. The Cu stands for copper because this peptide has a copper molecule attached to it, and that copper component is actually critical for how it works. What's really interesting about GHK-copper is that your level of this peptide declines dramatically as you get older. You hit peak levels around age 20, and then by the time you reach the age 60, you've lost about 60% of what you had when you were young. This decline correlates with a lot of the aging process we see in skin, tissue repair, and overall regeneration. GHK-copper has earned the nickname the youth molecule because of its anti-aging properties and what it does in the body. It activates tissue remodeling and wound healing pathways and stimulates production of collagen and elastin in your skin. The copper component is critical for enzyme function in the healing process because copper is a cofactor that many enzymes need to do their job properly. The peptide has been used in skincare products since the 1990s, and it may improve hair quality, size, and promote hair growth, which is why you'll see it in so many hair loss treatments. It works both topically when you apply it to your skin and systemically when you take it internally through injections. For people who are mainly interested in skin benefits, there are plenty of well-formulated skincare products containing GHK copper that you can use without needing a prescription or injection. But for systemic anti-aging effects, injectable forms used under the medical supervision may offer more comprehensive results. The safety profile is generally good, especially for topical use, which has been studied extensively, but as with any injectable peptide, you may want proper medical oversight to ensure you're using it correctly and monitoring for any unwanted side effects. Although GHK copper works at the tissue level to promote healing regeneration, there's another peptide that researchers believe might address aging at even more fundamental level, right down to your level of chromosomes themselves. It's called Epitalon, which is a synthetic 4-amino acid peptide that mimics a hormone called epithalin that's produced in your pineal gland. Epitalon is considered the fountain of youth peptide in longevity research because of what it supposedly does on your chromosomes. It activates an enzyme called telomerase, which is the enzyme that rebuilds the telomeres. The telomeres are these protective end caps on your chromosomes that get shorter every time your cells divide, kind of like the plastic tips on shoelaces that prevent them from fraying. When your telomeres get too short, your cells can't divide anymore, and they either die or become senescent, which means they stop functioning properly but don't die. This telomere shortening is literally one of the hallmarks of aging at the cellular level. So by activating telomerase and potentially lengthening telomeres, Epitalon may literally slow down cellular aging at its source. Animal studies have shown pretty remarkable results, with mice living 10 to 20% longer when giving Epitalon compared to mice that didn't receive it. There are also human studies suggesting improvements in sleep quality, energy levels, and various biomarkers of aging like cholesterol and immune function. Some people take it before bed specifically because of the sleep benefits it seems to provide, but there's very limited human data in Western medical literature. Most of this research on Epitalon comes from Russian studies conducted over several decades ago. While some of this research shows interesting results, it hasn't gone through the same extensive clinical trial process that FDA-approved medications undergo, which means the safety and efficacy is less robust than what we have for more established therapies. This represents the most experimental end of the peptide spectrum. The theoretical mechanism is fascinating. The idea that we might be able to influence cellular aging through telomerase activation, but human evidence is still developing. If you're considering Epitalon, you're working with a compound that has some intriguing data and some human studies, but not the extensive backing of the FDA-approved options. It's about understanding where different peptides fall on the spectrum from proven to promising and making informed decisions based upon your own assessment of the available science. With that said, there's another peptide that's actually FDA-approved and producing real-world results in weight loss and metabolic health. It's called Tirzepatide. It's FDA-approved for treating type 2 diabetes as of 2022 and obesity as of 2023. And this is hands down the most powerful weight loss peptide medication available right now. Part of the same class of drugs as semaglutide, but Tirzepatide is actually more effective than those medications. This is a peptide that mimics two natural hormones that your body already produces: GLP-1, which stands for glucagon-like 1 peptide, and GIP, which stands for glucose-dependent insulinotropic polypeptide. Both of these hormones are involved in regulating your blood sugar and your appetite. Beyond weight loss, there's emerging evidence that Tirzepatide may reverse fatty liver disease, which is a condition where fat builds up in your liver and can eventually lead to serious liver damage. This is becoming incredibly common as obesity rates rise, and we haven't got good treatments until now. The fact that Tirzepatide is FDA approved means we have extensive safety data. We know the proper dosing protocols, and it's been prescribed by doctors who understand how to monitor patients and manage any side effects that come up. But even Tirzepatide is incredibly effective overall weight loss, there's another FDA-approved peptide that targets a specific type of dangerous fat that accumulates around your organs. We call it Tesamorelin. It's a growth hormone releasing analog, which means it's a synthetic version of a hormone that tells your pituitary gland to release more growth hormone. It's FDA approved specifically for reducing visceral adipose tissue, which is the fancy term for belly fat that accumulates around your internal organs. This is the deep fat that wraps around your liver, intestines, and other organs, and it's the most dangerous type of fat you can have because it's metabolically active and produces inflammatory substances. This peptide was originally developed for HIV patients dealing with something called lipodystrophy, which is an abnormal distribution of body fat that happens as a side effect of certain HIV medications. Even with insurance, it's typically only covered for specific FDA-approved indications, which is HIV-related lipodystrophy. So if you're trying to use it for general viscous body fat reduction without the diagnosis, you're paying out of pocket. The effectiveness is real and the approval is legitimate, but the cost makes this inaccessible for a lot of people who might otherwise benefit from it. This is one of those situations where the science is sound and the clinical results are proven, but economics actually using it become limiting for most patients. Now, although Tesamorelin is proven and FDA approved for visceral body fat, there's another peptide fragment derived from growth hormone that's popular in fitness communities for fat loss, but it doesn't have the same level of clinical backing. It's AOD 9604, which simply stands for anti-obesity drug fragment. And it's a modified 15 amino acid fragment that comes from human growth hormone. What scientists did was they take a specific part of growth hormone molecule that was responsible for fat burning and isolated just that fragment. So theoretically, you get the fat burning effects of growth hormone without the growth effects that can cause problems like enlarged organs or insulin resistance. The idea is that you can mobilize fat stores and promote fat loss without all the other effects that come with taking full growth hormone. Some people also claim that AOD 9604 has cartilage repair benefits, but the evidence for this is pretty limited and not well established in the scientific literature. The peptide has become very popular in bodybuilding and the fitness communities because it's marketed as a way to get leaner without losing muscle mass. If you want proven FDA-approved medications with extensive safety data, AOD 9604 doesn't meet that criteria. If you're comfortable with being more experimental and using compounds that have a reasonable safety profile but limited clinical evidence, then at least you know what you're getting yourself into. So now that you understand what these 7 peptides are and what they potentially can do, you might be thinking how to actually access these peptides safely, legally, because this is where a lot of people make serious, dangerous mistakes that can affect their health and get them into trouble. So some of these peptides have gone through rigorous FDA approval process with extensive clinical trials and standardized dosing protocols. Others are in earlier stages of research and development, showing promising results in animal studies and limited human trials, but haven't completed the full regulatory approval pathway. When you're researching peptides online, you often see both categories discussed side by side without clear distinction between their regulatory status or the depth of evidence supporting them. This is where things get confusing because the level of established safety and efficacy varies significantly across different peptides. The challenge with sourcing peptides independently is ensuring that you're getting pharmaceutical grade quality with proper testing, purity, verification, and sterility standards. Quality control becomes a critical factor when you're working with injectable compounds. Other major problem is that most doctors know absolutely nothing about peptide therapy. The vast majority of physicians practicing traditional medicine have never prescribed peptides, don't understand dosing protocols, and don't know how to monitor patients for side effects, and frankly, don't have the time or interest to learn about these therapies because they're not part of standard medical training. This is exactly why you need help from board-certified physicians who actually specialize in peptide therapy and regenerative medicine. At Vive Wellness, we provide completely customized protocols based upon your specific goals, your laboratory results, and your complete medical history. We're doing comprehensive evaluations to figure out which interventions make sense for your unique situations and which ones don't. We work exclusively with licensed FDA-registered compounding pharmacies, which means you get a prescription for peptides through Vive, you're getting prescriptions for appropriate peptides that have been properly compounded, tested for purity, sterility, and dosed correctly. So if you're interested in exploring peptide therapy in a safe and medically supervised way, visit Vive Wellness and schedule a consultation. You can find us at vivewellness.com or give us a call to set up an evaluation where we can discuss your goals, run the appropriate testing, and create a personalized protocol that makes sense for your situation.